Welcome back to the second session this morning. I'll just take this opportunity to remind everyone that we have the question and answers box. You should see it at the bottom of your screen. If you have any questions for the speakers, feel free to put them there and I'll get to them if we have a few minutes after each speaker. So as not to delay any further, I'm going to introduce our first speakers. We have Carol Barron and Mary Jane Emmett from the Department of Nursing, Psychotherapy and Community Health in DCU. And I'll hand it over to you and you can introduce the topic of your talk yourself.
Good morning. Our talk this morning is on the impact of COVID-19 on children and adolescents' play, recreation and the friendship groups. Specifically, we're looking at how children use technology during this time frame. If I can get my slides to go full up on the screen, that would be really useful. All right.
You just hit slideshow from beginning there, up the top.
Yeah.
Up the PowerPoint.
Yeah, it's just this is on top of it. Hold on.
Or I think F8 on
your.
Got it.
Yeah. Okay. So, as we know, children's lives back in March were totally disrupted. Their normal everyday day-to-day lives, the closure of schools, playgrounds, after schools activities. And so their access to the outdoors was severely restricted. Now this practice of restricting children in the public realm and even in the private realm, it's not new and it's not unique to the COVID situation either. Over the last probably century and a half, there's been a gradual long-term shift in the spaces children occupy within our society and within societies internationally. It's from the outdoors to the indoors, from nature and fields and our streets to the back and the front gardens, to the bedrooms and to commercial play spaces, which have really taken off in the last probably 40 years. The urban historian, Sanford Gaster, looked at research in the States, and he said that between 1915 to 75, over the generations, there'd been a massive decrease in the number of places within the neighborhood for children's play. There was an increased number of physical barriers to place use by children and adolescents. There was much more direct control of the places that they could use, and much higher increased participation in paid unsupervised activities. Now, these findings, roughly all of them and a few more, they've been systematically repeated internationally. So obviously during a time of COVID, we hypothesized that these social restrictions would show an increase in indoor play and changes within the play activities of children. But specifically what we were looking at for this presentation was their use of technology to maintain the normalcy within their worlds. And I'm going to hand over now to my research assistant, Mary Jane, and she's going to take the next few slides. This is Mary Jane's first ever presentation, so I'm sure you'll all be very nice to her. Mary Jane?
Thanks, Carol. So I'm sure, as everyone in Ireland is very aware of the COVID-19 timeline here, we all lived through it. The first case that we had in Ireland was actually in a secondary school boy who had just come home from his holidays in Italy. So he brought that back here, unfortunately. And then the schools and colleges closed on the 12th of March, we all remember. By the end of March, we all got the stay-at-home orders and the first lockdown began. Some of the restrictions began to ease in May, and the government released its roadmap for the gradual reopening of the country. It was around this time, at the end of May and the beginning of June, when we released our survey. Next slide, please, Carol. So we had 1,476 participants for our survey. Over 200 of these were children, respondents, and the rest were parents who were answering on behalf of their children who would have been too young to answer it for themselves. So the parents answered for their children aged 4 to 13, and the children themselves answered, and they were 10 to 18. The adult responses were primarily mothers who answered for their children. And the survey itself was created using Qualtrics, and it consisted of a mix of qualitative and quantitative questions. And once the survey was closed, we imported the data into SPSS and analysed it there. Importantly, we found out that more than 1 in 10 of our participants actually had an extended family member. They knew someone who had been diagnosed with COVID-19 with a test. So even at this early stage, that was a lot. And the overwhelming majority of participants had a good understanding of COVID, and most of them also said that they were following the government's social distancing guidelines at this point. Next slide, please, Carol. So one of the questions we asked in our survey was about children's use of social media with the purpose of maintaining their friendships, because now they couldn't meet their friends face to face. So the question we asked was what methods of communication they were using in the past week to contact their friends. So the participants responded using a 5-point Likert scale to tell us how often they used these 7 of the most commonly recognized forms of communication through technology. So video calls, WhatsApp, text messaging, Facebook, Snapchat, Instagram, and Zoom or similar, or TikTok and blogs. Next slide, please. Upon analyzing the data, we combined the answers on this Likert scale. We combined the answers once a day, a few times a day, and constantly to give us a general idea of which technologies children were using once a day or more. So you can see on the table, we've split it into the children who were age 4 to 9, whose parents answered for them, and the children aged 10 to 18 who answered it for themselves. As you can see, the older children were using these technologies more than the younger children, which is to be expected. However, both age groups had the same top 3 platforms that they used to stay in touch with their friends the most often. And you can see from our traffic light system here, green was the most commonly used one, which was WhatsApp for both age groups. And then the older age groups used Snapchat or Instagram, the second most common, followed by video calls, and that was reversed for the younger age groups, but they still had the same top 3. Next slide, please. We also asked our participants a question on their indoor play activities and what changes were occurring to these activities since the pandemic began. Because social distancing measures, participants were shown these activities below, and they were asked to say whether they were doing less, the same as before the pandemic, or more than they were before the lockdown began. Next slide, please. This table again shows the percentage of children who said they were doing these activities more than they were before the pandemic began. And we divided it into the 2 age groups once again. And as you can see, you may not be totally surprised about, watching Netflix, TV, and films saw the biggest increase for both age groups, with 72% saying that they are watching movies and TV series more than before. Watching YouTube also saw a big increase for both age groups, even though it was more used in the older age group. And the use of Zoom for entertainment was another activity which saw a huge increase, again being more common in the older age group. Next slide, please. So children turned to technology and social media when social restrictions came into force. They had to use technology to keep in contact with their friends, and they had to attempt to satisfy their need for play and interaction with their friends through technology use. On the whole, children's use of technology for play increased by 55.6%. This is a lot more than the amount that their non-technology based forms of indoor play increased, which was also in the question, but it's just not included in this presentation. Perhaps the most notable increase was in the older children's use of Zoom, which increased 69% overall during the pandemic. This is big because this communication platform was relatively unknown to most kids a year ago before the pandemic. So for this to be seen is a huge increase. Thanks, Carol.
Okay. We asked the children what was their best ideas, to help them play and hang out. And in relation to the technology, the children across the different age spans had different ideas. So, I mean, if you look, like girls of 11 were doing dances on TikTok, Zoom, popular with boys and girls, taking computer screens outside into the garden, setting up for movie nights outside. But technology doesn't suit all children. So some children with special needs, particularly say hearing difficulties, things like that, I can only speak with some friends on WhatsApp, but that's difficult due to their hearing issue. So while it was very beneficial, I know we always talk about the negative impacts of technology and children's activities, but it was very beneficial for children in maintaining their friendship groups and normalization, but it didn't suit all. We asked the children, how they felt about some of the social restrictions and their ability to play and maintain their normal routines. And again, it was a 5-point Likert scale. What upset the children the most is I'm upset because I can't see my friends outside of my home. And they're very high numbers. If you look, again, we divide them between the 4 and 9-year-olds and the 10 to 18-year-olds. So even 72% of 10 to 18-year-olds said they were very upset not being able to meet their friends face to face. Unsurprisingly then, perhaps sports, again, very important to the older children, but equally to the younger children, but more so for the older. In relation to going to school, about half of both cohorts said they were upset because they can't go to school, slightly higher for the younger children, but not by a lot. I know this looks like it's a very busy slide and I'm not going to talk at it, but it just shows you the responses from the children. These are all children's responses about the absence of friends. Okay, so it was we asked about the hardest thing about social restrictions, and this is what they told us. While I haven't got it on this slide, there was a lot of mental health issues. I'm sad, I'm lonely, my mood is black. It certainly did appear to have impact on Irish children anyway. I also ran this survey out in Italy, the UK, and the States, and although this is only the Irish data here today, and it's the same thing is coming up over and over in relation to both technology and the importance of the absence of their ability to relate to their friends, meet their friends. So for children to access both the public and the private realm, it is absolutely linked to the presence of their friends nearby. The lack of both social, physical, and emotional contact with their friends is highly impactful onto children's lives, and not just the older children. I think resilience, the concept of resilience, I think children's friendships groups and the support they receive from them may play an important role in children's resilience. We also asked the children, we asked them to prioritise what the Irish government could do to help improve their ability to hang out or play during the time of the lockdown. And remember, the survey was run out at the very end of May, the first few days of June, just as we were easing the restrictions. So we said to open playgrounds, sports clubs, the schools, creches, etc. The number one choice for both the children and the parents was to allow their children to meet their friends face to face. So it wasn't to do with resources or reopening spaces or places. It was allowing them to meet their friends. So just, I guess, in conclusions, in relation to TV and Netflix, Toby Miller argues very persuasively against the death of TV rhetoric, which has come out probably in the last 10 years. So we all know there's a massive amount of literature out there on the impact of television, sedentary lifestyles on children. And the most recent rhetoric in relation to television is kind of saying it's lost its place as the shrine within people's living rooms. And Toby Miller argues against this, and that would follow what we have found in Ireland and in Italy as well, that there's massive increase in TV and Netflix viewing, 72%. It's almost identical for both age cohorts. Now, the Netflix is interesting because Netflix and binge viewing they're almost synonymous. It's a default consumption mode for Netflix. And it's very prevalent, especially with younger viewers. Now, binge viewing is changing how children and adolescents consume TV programs. This is not specific to COVID, because obviously Netflix was there prior to that, but how the length of COVID has lasted and the amount of binge viewing that children have done I don't know the long-term impacts from that yet. Mobile phones. Children younger and younger have mobile phones, and the technology that they're using, the WhatsApp, the Snapchat, once they have a phone, they can access all these platforms. And they're very popular with Irish children and adolescents. And they did play a positive and important role in maintaining contact with their friends during that time. New and old platforms. TikTok is interesting in that it only rose to global prominence, I guess, in 2019. It's one of the fastest growing short video platforms in the world. It's largely comprised of user-generated content. Now, while that throws up all sorts of issues, that's not the focus for today. But even like 9.8%, so 1 in 10 children between the age of 4 and 9 are uploading data onto TikTok. And 30% of 10 to 18-year-olds use it at least once a day to maintain contact with their friends, to send them the short videos. Facebook is going the other direction. We already knew that Facebook had dropped off in young people and older adolescents, but it's significantly decreased even in the younger age cohorts here. So it's not a platform that's used well by children anymore. The inability of children to meet their friends was the single most difficult aspect in children's perspectives of the entire lockdown. So it wasn't their sports or going to school, but it was their friends. When asked how the government could help them to maintain their play and hanging out outside, the number one choice, as I've said, was to allow them to meet their friends. This is significantly linked to children's ability and their motivation to access the outdoors for socialization, taking part in play activities, and their emotional, mental, and physical well-being. Okay. And again, 64.8% of parents with young children, 4 to 9, and 72% of the older children, slightly higher, said that they were very upset about not being able to maintain their normal face-to-face contact and friendship groups. And that's our presentation. Thank you very much for listening.
Thank you, Carol, and thank you, Mary Jane, and well done on your first ever presentation. I just have a couple of questions. I'll put them both to you initially. The first question was just around, is there any indication that this type of activity will continue? So the kind of lasting effect from an activity perspective, rather than the impact it's having on friendships or mental health, I suppose, which is a separate issue. And then are other countries doing anything to, or is there other examples of interventions that would help to shift back to what was maybe a bit more social activity face to face?
Yeah, well, when we looked at the Italian data, it was very similar to our own. So the very high increase in television and Netflix, especially if you're looking at developed countries that all have internet access. So there was huge use of those social platforms. I guess because we tend to look at the technology negatively, in this instance, it did play a positive impact because it did maintain friendships, maintain relationships, maintain contact. And children were quite creative in how they used it. So if you're looking at it from a child's perspective, as opposed to the adult's perspective, they were able to transform that technology to use it to meet their needs. So having the movie nights out in the back garden, stuff like that. Yeah. Longer term, the Netflix is interesting in relation to binge consumption, has already been there, but it's been exacerbated during COVID. And I think it's a little bit worrying that 1 in 10 children aged 4 to 9 are uploading onto TikTok. So, and there's a huge amount of issues with that, but that is just taking off extremely fast. Now, whether it's still as popular in 2 years or 5 years, it's too early to say yet, but.
Brilliant. Thanks, Carol. Just a really interesting presentation and very valuable data that you were able to collect there.